Thank you, Chairman Feinstein and Ranking Member Grassley, and thank you for letting me just make a brief opening statement. This impacts my state a lot, and it's such an important issue, and it's hitting home very hard. New Mexico has the sad distinction of having the highest rate of drug overdose deaths in the country. It's tragic and it's unacceptable. The nation's drug epidemic has moved from the streets to our medicine cabinets, from illicit drugs to prescription drugs, but the outcome is the same: destroyed lives, unnecessary deaths, and it reaches every racial, geographical, and social economic group. Since 2007, more New Mexicans have overdosed and died from prescription drugs like oxycodone, morphine, and methadone than from illicit drugs like heroin and cocaine. In the last decade alone, we've seen the overdose rate from prescriptions increase by over 60%. Pills are easy to get hold of, far too easily, especially for young people. Law enforcement has identified diverted prescription drugs that fall into the wrong hands as the most significant emerging drug threat statewide. They've also learned that prescription drug abuse is a gateway to heroin use. New Mexico teenagers and young adults are taking prescriptions to get high, but pills are expensive. Once they're addicted, they are resorting to heroin for two reasons. It's cheaper and easier to get, a lethal combination, and tragically, they are dying from it. This issue hits close to home for many of us. One of my own staff members, who was raised in Albuquerque, shared his story with me this week as we were preparing for this hearing. He's seen the problem firsthand. Over the last 3 months, 4 people he went to Cibola High School with have died from heroin overdoses. 4 deaths in 3 months. One was his best friend of 20 years, Michael. He was 30 years old. All 4 turned to heroin after abusing prescription drugs. Like many, Michael had sought treatment with the support of his family. He completed a 90-day private rehabilitation program. He was trying to stay clean. So you can see this is a great challenge we're facing in New Mexico. The State Pharmacy Board, physicians, epidemiologists, all are working hard to confront this growing problem, working to increase public health and education. And this discussion we're having here and the testimony we're hearing, I think, will go a long way to try to see where we come out in terms of solutions. And thank you, Chairman Feinstein, for this, and Ranking Member Grassley. Appreciate the opportunity to give a statement. Look forward to questioning the witnesses.